Greetings, Eric Backer, naturopath from New Zealand, author of Candida Crusher and formulator of the CanXida range of dietary supplements. Thank you so much for checking out my video. Today I'm going to talk about the 10 signs that you may have a parasite infection. So people often freak out when they hear the word parasite. They think of things like Godzilla or something out of Star Wars or some huge creature with hooks and stuff. Tentacles, something that gets inside you and is ripping your intestines apart, and huge worms crawling through your guts and coming out your bum and all this kind of stuff. And that's not parasites. That's some science fiction movie you're thinking about. Forget about it, all right? Parasites, usually you can't even see the darn things, they're so small, okay? So a parasite is basically an organism that feeds off another organism. I've got 4 teenagers. Well, they're grown up now, and you can almost consider them parasites because they like feed off the adults. You know, they come into the home during the holidays, they raid the fridge, and they're gone. You know, but they're not really parasites. Some people consider politicians to be parasites because they take and take and take, and they give nothing back. No, that's not parasites. The parasites I'm referring to are basically microorganisms. Now, many people equate parasites with worms, like hookworms and pinworms and tapeworms, things like that. So people have emailed me over the years. I've seen this huge big white thing coming out of my stool, wriggling around in the toilet bowl. Is it a worm of some sort? Is it a parasite? Those things don't happen to people usually, okay? You can get tapeworms and like pinworms and hookworms, but you're not going to pass motions and see like creatures, you know, doing freestyle or breaststroke in the toilet bowl. These things are just fantasy land. They don't really happen. Seeing stuff in the stool usually means undigested food particles, okay? Some people literally eat their dinner like a German Shepherd would eat its food. Gone, okay? 3 or 4 bites, they swallow it and it's gone, okay? They don't even chew food. Remember, if you can't chew properly, you can't poo properly, all right? The other saying I really like, I heard when I was in the States years ago, was small stools, big hospitals, big stools, small hospitals. So people who poo properly are the ones who chew properly, right? So parasites can happen, and they do happen to a lot of people, but please take it out of your mind that all sorts of weird particles in your stool are probably going to be parasites, because there's a big chance they're probably undigested food particles. I've just spent a little bit of time on the internet looking at Dr. Google again, looking at different blog sites on parasites, and one prominent, person here is talking all about worms and stuff like that, and normally you can feel and see parasites, but that's actually not true. In fact, most parasitic infections you can't see with the eye at all. You need a microscope to see it. They're so minuscule, and even then it's hard to detect with a microscope. Sometimes you need a DNA technology to determine if there's a parasite in the stool or not. And this is how many doctors actually miss out on parasites, right? So conventional stool testing, in my opinion, is a waste of time for parasites. Usually they need a live parasite to find it, to see it moving across this line. Okay, they don't use what we call PCR technology. Okay, PCR means polymerase chain reaction. I keep forgetting the word polymerase. Polymerase chain reaction is a special DNA technique where they can actually see the DNA footprint of the parasite. So it's quite a high-tech way of finding a bug in someone's stool, whether it's dead or alive, whether there's an egg there or part of the parasite, it can be picked up accurately. Blastocystis is a very common parasite I see in people. You can't see it with the naked eye. It's passed from human to human quite quickly. Pets often give it to people. Cows, chickens, domestic animals, pigs. It's easily transferred to humans. Humans easily transfer it to other humans. So how do you get these bugs? Well, international travel used to be the big thing with parasites, but I'm sorry to tell you, but the chances that you've got a parasite are quite high these days. Many people have got blastocystis. An amazing amount of stool samples I see, I can pick them up. So, can you feel parasites? What are the common things that you would experience with parasites? How do you know you got these things? What are the signs? Well, one of the most common things we look for naturally is a bowel function disorder, a change in bowel pattern. But I'm going to go through some of these 10 signs and symptoms now and elaborate on them a little bit for you. So, having unexplained constipation or diarrhea, gas, or symptoms of irritable bowel syndrome, right? IBS, there's a big chance if your bowel's been playing up for a while. My question to you is, try and work out when it started and backtrack. Were you traveling? Were you camping? Were you glamping? You've heard of glamping? That's apparently the fashion these days. It's camping in style, think about that. Did you go away for a weekend somewhere? What did you do? Can you remember a particular incident where you went to a party or something and you didn't feel well after? That could have been the beginning of the IBS. The important thing is to work out who you were with, because they may have had something at that time too. You travel internationally. Maybe you got diarrhea when you were overseas, or you saw a doctor over there. This is a classic sign of parasite problems. We get a lot of that in New Zealand with people going to the islands here, Fiji, Rarotonga, and those sorts of places. And if you're in the US, it might have been the Caribbean or Central America, or a place like that. And in Europe, you may have gone to, I don't know, the Canary Islands, or, I don't know really Europe that well. You may have a history of what we call a dodgy stomach, okay? Stomach's not good. Foods don't really sit with you. You may have a history of food poisoning, for example, going to a party or a wedding, and, or one of my patients recently went on a plane and she ate a chicken sandwich on a plane, and then by the time she got off, she was running to the toilet. So she knew what was going on there. Sometimes sleeping disturbances or a really strange change in sleeping pattern can give you an idea that you could have a bug going on internally, so that might need checking out. A classic one is skin irritations. Many people with parasites develop itchy skin or flare-ups on the inner thigh, or on the upper arms, or around the neck or parts of the face. So in that case, if it's persistent, definitely get a blood test done and a stool test done to check for parasites, and also for kidney function and liver function to see if everything's okay. So skin irritations. Pharmaceutical medications can cause that too, so you need to really differentiate there. Grinding teeth in sleep. It's a classic with children with worms. Lots of kids grind their teeth in sleep. So boring the finger in the nose, a child, and itchy bum, grinding the teeth, these are all signs usually of roundworm infections. Okay, so kids are easily treated for worm infections. Aches in muscles or joints, especially in conjunction with skin irritations. This can also be a clear indication of a parasite problem. Aching in the body. Experiencing feelings of apathy or exhaustion or depression, especially in conjunction with the travel and the change in the bowel pattern. Try and put 2 or 3 of these things together to see. The more you've got, the higher the incidence or probability that it's a parasite. You've been diagnosed with iron deficient anemia. So there are certain types of bacteria and parasites that like to eat iron in the gut. Okay, they gobble them up. So if you've got persistent low iron and it's unexplained, definitely get a stool test done, a comprehensive one. You never feel full or satisfied after any kind of food you've eaten. So sometimes if you've got worm infections, the worm needs food and you need food. So you can eat and the parasites will eat alongside you. Sounds like teenagers, doesn't it? You experience fatigue. Tiredness is a big one with parasites. So this tiredness, think about that. Have you recently become tired after traveling? Have you been to a weekend excursion with people, got a bowel change, got fatigue, itchy skin or things like that? If in doubt, my solution is get a comprehensive stool test done. A CDSA times 3, so 3 stool samples tested independently, 3 concurrent days, the samples taken, goes to a specialty lab. You can get this done by your physician, or I can help you out if you need, steer in the right direction. And then treatment. Okay, parasites respond beautifully to natural medicine treatment. In fact, they respond better than pharmaceutical medications, in my opinion, because good natural medicines do not eradicate beneficial bacteria. I can't tell you how many people I've seen over the years, hundreds, if not thousands of people who've had a parasite, went down the medical route, and in some cases got triple therapy by clinics like the Centre for Digestive Diseases in Sydney, Australia, for example, got put on drugs, secnidazole and trimethoprim and diloxanide and drugs like that, metronidazole, and then ended up getting a partial result and then getting sick again. I haven't seen this once, I haven't seen this twice, I haven't seen it 3 times, I've seen it hundreds of times. So my advice to you first is to go for the natural treatment first, okay? If you do it properly, in conjunction with diet and some lifestyle changes and some dietary supplements, you should get a good result. If you don't, then my advice, again, would be to check out why you're not responding. Are you staying up too late? Are you working too long? Are you drinking a few beers or wines on the side trying to kill these bugs, You've got to play the game right if you want to win the game, right? Now, believe me, I've worked with a lot of people with parasites over the years. You can get an outstanding result with the right kind of treatment, right? Check out some of my other videos where I talk about blastocystis and other parasites. You'll learn a lot more from that kind of information. Check out my CanXida range of dietary supplements, because they were produced by me not just for yeast infection, but also to target parasites, many different types of parasites. How do I know they work? Because of the constant feedback I'm getting from patients and for people through this YouTube channel and through other means online. Which is really cool. And of course, we always get certain people who don't respond to natural medicines, and in that case, we look at pharmaceutical intervention. But why would you want to use a nuclear bomb when you can get rid of a target with a handgun first? Makes sense? Less collateral damage. All right. So I hope you learned a little bit about parasites through this video. So the common signs, let's just quickly go over them again. Change in bowel pattern, fatigue, tiredness, itchy skin, aches or muscle, joints or muscle problems, especially unexplained. All right. Think about those things. What were the other ones that we were talking about? We'll just quickly go over them. Teeth grinding, especially for younger people and children. Sleeping issues, travel. Okay, you've been to a barbecue or you've been to a wedding and you had some dodgy food, you got a bit sick, or you didn't feel quite right after a meal out at a cheap restaurant or something. Think about that. Could have been that. So those are the sort of things I want you to think about when it comes to the typical signs of a parasite. Right? So it's time to say goodbye. Please click on the link below if you haven't already got my free report. And thanks for tuning in.